Hello and welcome to For Your Health, a program that helps you to stay informed and, of course, stay healthy. That's why health is in the title, I suppose. This program does travel throughout the country, and we certainly thank the access centers that do air this program for airing this program. A special shout out to BevCam, that is Beverly Community Access Television here in the state of Massachusetts. Thank you so much. And to the rest of the stations, we certainly appreciate that you find this material that we provide in this program to be of use, and certainly I do. And my guest is a wealth of knowledge. My guest is Caitlin Kirby. She is a public health nurse for the city of Quincy. Caitlin, welcome back.
Thank you for having me, as always.
Always a pleasure to have you, and clearly you're needed throughout, or I should say beyond the city limits, because folks find the information that you share to be very relevant.
Yes, and I always try to do topics, like I always mention my biggest sources. I go through the CDC, the Center of Disease Control, and the Massachusetts State Health Department. So it definitely is universal information when it comes to this.
Definitely, and for folks beyond Massachusetts, naturally there's Board of Health throughout the country.
Yes, yes. So when in doubt, if I ever mention something that seems more localized to either Quincy or Massachusetts in general, definitely worth checking in with your local Board of Health to see what's available.
Very good. Today's topic is hepatitis A and B. Folks will know, or may not know, that there's actually a variety of types of hepatitis. Today we will be focusing on A and B.
Yeah, so there are 5 different types, but I did want to focus on both hepatitis A and B, mostly because they are preventative through vaccination. So I figured that's very important information for people to know about. And also because as a local Board of Health nurse, we work very closely with the state health department. So when individuals are diagnosed with hepatitis A or B, especially if it's an acute case, we work very closely to investigate those cases to help further stop that spread through contact tracing. So that's why I wanted to specify really on hepatitis A and B today.
Very good. We'll start with an overview because that's a good way to break things down for folks. We will start with the definition. What is hepatitis? We will look at symptoms of hepatitis, causes of hepatitis A, treatment and prevention. So hepatitis A, causes, treatment and prevention. Hepatitis B, causes, treatment and prevention. And lastly, we will talk about vaccinations. So as we begin this program, let's start with the definition. As promised, what is hepatitis?
Yeah, so to understand hepatitis, it's very important to know what the liver does. So the liver is an organ that processes nutrients, it filters your blood, and it fights infections. So of course this is a very important organ within your system. The liver is located in the right upper quadrant of your abdomen. And it is the largest organ within the body. It's about the size of a football.
I didn't know it was the largest organ.
Yeah, well, the largest organ is actually the skin,
right.
But within the body,
Right.
the liver.
Yeah.
But so with that being said, those are the functions of what the liver does. And hepatitis, that word simply means an inflammation of the liver. So if you have an inflammation of the liver, it cannot properly function as it should. So this inflammation of the liver has a couple different causes. So it can be a viral or a virus infection, drugs, alcohol, a genetic disorder, and an overactive immune system. So there's definitely a lot of risk factors, but there are some genetic components to it. So it's important to know your family history. And as you mentioned, there are different types of hepatitis. There are actually 5 main types, which are A, B, C, D, and E. But again, we will primarily focus on this A and B today, simply because we don't have enough time to go in depth on every single one. But again, that A and B, as a local Board of Health nurse, we're very involved with helping investigate to help stop the spread to other individuals.
And I know we will break down hepatitis A and B, but when we're talking about symptoms, are the symptoms the same for both?
Yeah, so where this inflammation is within the liver, you will typically see the same symptoms. And it's important to know people's bodies react a little bit differently. So you may not have every single symptom, but if you, as I review these symptoms, if you yourself watching the episode believes you have these symptoms, or a loved one is experiencing any of these, I definitely suggest checking in with a doctor, either your primary care doctor, or if you don't have one, going to an urgent care and just seeking further guidance. Because I think we say with every show, the internet can be a really good resource, but sometimes when you get lost in that, you never want to self-diagnose, because with your body, so many symptoms can be from a different disease.
So we say, I know we've said this in the past, that it's okay to use the internet, but then go to your doctor with maybe what you've researched on the internet. So it might provide you a better way to explain to your doctor what you may be feeling, what you may be experiencing?
Yes, but I always say seek a doctor's advice, never self-diagnose. And with a lot of these conditions, it does require different treatments. And in hepatitis, you may require a vaccination. So always check in with your doctor to be safe.
So I guess we will look at symptoms and look first at acute symptoms.
Yes, so, but with hepatitis, you can have acute hepatitis, so it's very instantaneous. So with the acute symptoms, you might have a low-grade fever, you might have loss of appetite, fatigue, and aching joints. And then some individuals that experience hepatitis, they can have chronic symptoms, so it's more long-lasting. And these chronic symptoms we may see are dark urine, sudden nausea and vomiting, abdominal pain or discomfort, and especially that's in the right upper side of your lower ribs, because you want to think that's where your liver is located. You may also see jaundice, which is when you get a yellow tint to your skin in your eyes. It can be very apparent in your eyes where it's normally white. That's typically something you notice pretty quickly. And you may also see pale or clay color stools when you go to the bathroom. So any of these symptoms are alarming. So definitely, again, check in with your doctor and make sure you're following up to rule anything out and make sure you don't require treatment.
So hepatitis A causes.
Okay, so for hepatitis A, this is spread through fecal-oral transmission. So what we mean by that is this hepatitis A virus, when an individual is sick, that virus lives, when they do have a bowel movement, it lives in the stool. So you think of that, that's why we always encourage hand washing with everything we do, every illness. But if you think of that, if a sick individual goes to the bathroom and then doesn't wash their hands after, and then they go to eat something or touch something, and then the next person's touching that object and touching their mouth, that's how it's really spread.
And it doesn't only have to be the mouth, it could be the nose, the eyes.
Yes, any of those mucous membranes where it's absorbed into your body. But it also can be spread, if it's not by an infected individual, it can also be spread through food and water that is prepared by that infected individual. I apologize, I was jumping ahead a little bit. We also see this with eating raw shellfish. from water that's polluted with sewage. So what we do when we do an investigation on a hepatitis A case, we first look to see if the individual was exposed to somebody that they're aware of, or a high risk factor would be if IV drug use or homelessness. We do see it kind of spread a little bit more easily in those populations. But if people say, no, I've had no contact, I haven't been in any shelters or anything like that, we actually look to see if they've had any recent shellfish. And that is an emergent thing. We would have the food inspectors, whether it was in our city or town, or we would notify whatever town it was in for the food inspectors to go out. And restaurants are mandated when they serve shellfish, they have to keep the tags on that shellfish for a certain amount of time. So that way, if God forbid we see an infection, they can look back to see where those shellfish actually came from.
It's traceable.
So it's traceable. It's very time sensitive, because of course if we don't know till a month later, sometimes it's too late to be able to trace that. So that's why when we get these investigations, they're immediate and we start calling and making those calls as soon as possible. And as we're saying, like with the fecal oral transmission, it's like if you had close contact with an infected person, and the primary cause for it being passed between individuals is if there's like poor sanitation and poor personal hygiene. So again, that's why with any of these viruses, we're always very big on hand washing, especially before eating.
And since you brought up hand washing, there is a correct way to hand wash. You should do it for a certain period of time.
Yeah, so definitely if you're out and about, hand sanitizer can be utilized until you can get to a sink. But you do want to wash your hands with warm water and soap. It's the best way. And a good method that I think we've mentioned before is if you sing happy birthday twice as you're washing your hands. It's a good way to teach children, of course, how to wash their hands properly. But singing that song twice while you wash your hands and really lather them, get under your fingernails, in between your hands, just to ensure that your hands are clean.
I think often folks, especially kids, will wash the palms and forget about the back side, I suppose, of your hands. But you really need to wash all around.
All around, just to make sure you get all the germs, of course.
Of course. Treatment and prevention.
Yeah, so people can be sick for a few days so a few weeks up to a few months with this hepatitis A, but most do recover with no long-lasting damage to their liver. There is no specific treatment where this is a virus. There's no, really, if you do require hospitalization, it's more, they would treat you for your symptoms. So you may get some IV fluids. If you have a fever, they may give Tylenol. But it's more so treating the symptoms, not treating that virus itself. And the best way to prevent is vaccination. So the hepatitis A vaccine, it is with 2 vaccines. So you get one and then there's a time period until you get your second one. If you only get 1 vaccine, you have a little bit of protection, but it is very much advised to finish the series to ensure that protection. And then as we kept mentioning the transmission of hepatitis A, one of the best ways is that hand washing to protect yourself too.
Good hygiene. Don't share toothbrushes, that kind of a thing as well.
Yes, yes.
Hepatitis B causes. So we're now changing over to hepatitis B.
Yes, so unlike hepatitis A, that is a fecal oral transmission, hepatitis B is a blood-borne pathogen. So this is spread through direct blood-to-blood contact with an infected person. So with hepatitis B, it's not so much the hand-to-hand like transmission. Where it's blood to blood, we see this more often if there's for IV drug users, if they're sharing needles, or through sexual contact with an infected person. So again, that's why it's so important to be vaccinated, use protection.
And how, just going back to vaccinations, to the topic of vaccinations, once you are vaccinated, are you vaccinated for life?
Yes, with this hepatitis A and B,
Okay.
yes. And where it's a bloodborne pathogen, it's actually important to know that pregnant women who are infected with hepatitis B can pass the virus to babies during childbirth. So luckily, not very often, but I've been in the health department for about 5 years now, and I've had only a select few hepatitis B investigations, which is great. But typically when we do get notified for those, it will be if there's an individual who's pregnant, like a woman who's pregnant. We would check in with them to make sure they got the vaccine and all of that, because our concern there is spreading it to the child.
Absolutely.
But it's very important to know that hepatitis B cannot be spread through casual interactions such as holding hands, sharing meals, or food preparation. Yeah.
And now we're moving to treatment and prevention. Again, this is for hepatitis B.
Yeah, so with the hepatitis B, there's no medication. Again, it's still a viral infection. But if somebody were to have chronic hepatitis B, regular monitoring by a medical professional is required. And this medical professional would monitor the individual for signs of liver disease progression. And they can be treated with antiviral drugs. And with the hepatitis B, according to the CDC, 15 to 25% of chronically infected individuals can develop chronic liver disease, including liver failure and liver cancer. So that's why it's so important to follow up with your doctor, work with your doctor, and make sure you're following the treatment plan to help slow the progression of, say, liver disease or liver failure.
Does the liver, if it's a portion of the liver that's infected, can that be cut away? Does the liver regenerate? Does it grow back?
It does, but definitely with hepatitis B, typically that's not so much a treatment. It's more the antivirals that they would go with.
Right.
Yeah.
I guess I was mindful of the fact that that the liver is one of those organs that does, I guess, regrow.
Yes, yes. And again, with this, as we'll get into next, vaccination is really the best way and only way to prevent hepatitis B.
And since you led so seamlessly into vaccinations, let's talk more about vaccinations.
Yeah, so as I keep mentioning that hepatitis A, there's the 2 vaccine doses. For hepatitis B, it is the 3-dose series. And so I'll provide go through a list of individuals who are recommended to get this vaccine. So both of these vaccines are recommended for all infants, children, and adolescents younger than 19 years old.
So for the most part, you go to a pediatric doctor, your child has received this shot.
Yeah, so the pediatrician would be, these are along with the routine vaccinations for a child. So as long as that child is following up appropriately with that pediatrician, they should be vaccinated for this. Also, people at risk for infection through sexual exposure, including men who have sex with other men. That's very important that they make sure that they're vaccinated to protect themselves. We also see individuals who inject drugs, in people that have an occupational risk factor. So that's individuals, if you work closely with needles or anything like that, it's important to make sure you're vaccinated. It's interesting for tattoo artists, we do licensing for tattoo artists through the health department, and that's one requirement we look for when they put their application in. They either have to provide me their hepatitis B vaccination status, or they can sign a declination if they don't want to get the vaccines. But it's important because tattoo artists, they're injecting needles into individuals. So they're at a high risk. So that would be an occupational exposure.
Right, and that actually leads me to the proper disposal of needles.
Yeah, so needles, you definitely, if you see a needle, I recommend not picking it up yourself. We do actually get calls in the health department, and what we do is we train like our DPW, who like in charge of all the parks and everything in the recreational department. We do bloodborne pathogens training with them. So you don't want to touch it with your hand if you can prevent that. Like if you have like a pair of tongs or something to pick it up, you want to put it directly into a sharps container, which is like the red sharps container with the labels on it. So when in doubt, if you see one in front of a grocery store, call the local board of health and we'll come up and pick it up ourselves. Because you always, if you had to in an instant, pick it up by the end. You never want to pick it up by the top where the needle is. Because even if you don't see the needle, you want to make sure you are not getting stuck with that needle by any means.
Very good. People who travel
Yes.
internationally.
So people who travel internationally, there's always that risk of being exposed by somebody else. Individuals who are in jail or prison, you think of that as it's individuals that live very closely with each other. Individuals who have HIV or a lower immune system, pregnant women, and then really any person who's just seeking protection. And I wanted to add, like, if you are at home watching this right now and you're unaware of your vaccine status, you can check with your doctor. And you could also check with your local board of health. Here, I'm not sure if other states do it differently, but here in Massachusetts, the state health department has an immunization database, MIIS is what we call it. And as a local board of health employee nurse, where we do vaccines, we have access to that. So we could go right in with your name and date of birth to see if it's logged into there. I will say with that system, I find like a lot of like younger individuals, so 18 and younger, all of their vaccines are put directly into the system because their doctors are mandated to enter everything right in. Whereas even where I'm 30, some of my vaccines weren't transitioned over. So you can check with your local board of health if you want to check that state system, or your primary care should have a list. If you don't know, they deem you could be at risk, they can do a titer too to see if your body has antibodies to hepatitis B and A.
Very good. I'm
Yeah.
55, so I think a lot of mine were written down on probably a card.
Yes. Yeah.
Hopefully, at this point, transferred to that database.
Yeah, so it's and a lot of, like, I will say, as I mentioned mine, I do think my doctor did when that system came into acting. I'm not aware of when they started utilizing that, but they did transfer a lot of their records, so that would be in there. But I just have found with some individuals, when I go to look in there might be nothing in there. It might be like a flu vaccine that they had recently or a COVID vaccine. But I would say if you're not in there, don't hesitate. Hopefully your doctor has your records. And if you don't know, check in with your doctor and voice your concerns so they're aware.
Very good. I did say cardstock. I meant, well, maybe I should have said cave walls. I'm dating myself even further. Thank you so much again. Great information, great topic that you chose, and I guess the fact that so many people benefit, again, locally and throughout the country certainly is a testament to you.
Yes, and just before we end, I don't think I mentioned this at the beginning, but I did want to thank my two coworkers who are both epidemiologists. They did a lot of research on this topic. So that would be Jay Young Chow in Sopexo Sandy. Sopexo Sandy So. They are brilliant. They do bring a lot to our health department here and their wealth of knowledge. So if anybody, especially in our local area, if they want to see a different topic, definitely give us a call, and we're happy to do the research to provide the information.
Very good, and I'd be happy to host. Awesome. And get the information out there to folks. So thank you so much once again for joining me and talking about, in this case, hepatitis.
Of course. Thank you for having me.
Thank you. And thank you. A lot of thank yous. Thank you for watching. And just remember to support your local access television station in the community in which you reside. So please stay healthy, and we'll see you next time.